This week on Africa Health Check.
Botswana, the curriculum was behind. We had to learn new things, we had to adapt.
I couldn't afford to do the online. The school that they're going, they didn't have that online classes.
We review the education system in Africa.
We're building a more convenient, more high quality education in the continent.
And its adaptations to the COVID-19 pandemic. Hello and welcome back again. I trust that you had pleasant and restful holidays. This is the new year. Let us be in positive spirits. I certainly hope that you have a really prosperous 2022. This is Africa Health Check once more, where we discuss Africa's response to the COVID-19 pandemic. I am Horontle Jampaladi. The education sector is among the sectors that were hugely affected by COVID-19 and the subsequent measurements that were put in place in order to reduce the spread, such as the lockdown. On today's episode, we will be discussing the impact of COVID-19 pandemic on the education sector in Africa. But before we get into the discussion, let us have a look at Africa in numbers. The Omicron and Delta variant infection rates being reported across the continent are pushing many countries in Africa to that peak of infections. These are some of the peak values by countries at the worst stages of the outbreak, according to the Africa CDC. As of the 27th of December, the latest 7-day average deaths show that South Africa leads with 57 reported deaths per day, followed by Egypt at 39, Zimbabwe at 12, Tunisia at 8, and Libya at 7 deaths per day. And that is our Africa in Numbers segment for this episode. This week, we will be discussing the impact of COVID-19 on the education sector in Africa. And to help me with that discussion, we have a special panelist all the way from Rwanda. We have Benjamin Karenzi, and he is the CEO of Zora Robotics Africa. As usual, we have our commentators, Dr. Marianne Morathi, who's the current chair of the Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi in Kenya, as well as Reverend Anthony Achampong from Ghana, who is a pharmacist and a pastor. But before we hear from these experts, let us have a look at this week's feature.
My name is Sam Gishiru. I'm CEO and founder at Kidato. Kidato is an online school. We're building a more convenient, more high quality education in the continent. For me, it was at the end of 2019 where I started homeschooling my own children. I have 3 sons, simply because I noticed that the cost and the quality wasn't matching up. I noticed a couple of challenges. When it goes to public school, you get low quality education. When you go to private school, you pay an arm and a leg for it. There was no really nice in-between space in there. Unfortunately, COVID hit 2020 in Africa, and around March, going to April, there was a total lockdown. And my children never missed a day of school. Along the way in 2020, we decided to convert this into an actual online school. At the end of September, we had 11 children joining our school. And now we've been just growing gradually since September 2020. We are a year plus 2 months old. We have a close to 30 teachers spread out. We have students from about 8 countries in the world, and we're still growing. The first benefit is convenience. We have a culture where children wake up at 5 o'clock to be in the school bus at 6 o'clock to be in class at 8. So children are ending up with almost 15-hour days, from the time they wake up to the time they actually hit the bed again. And in these 15 hours, they have spent less than 30 minutes or an hour with the parents. When I mentioned convenience, I forgot to mention that for parents who work for organizations like United Nations and other organizations that keep on sending them to different parts of the world, they do not have to worry about where their job takes them, because they can travel with their children and their children are still in class. So that convenience is a really, really big factor for myself, and I use myself as a parent in Kidato as an example. That I've spent a lot more time with my children the last years than I ever did. The second item for me is cost. The cost of Start from uniform. They look basic, but the uniform is their school bags or their shoes. Then there's a cost of transport. Then there's a cost of lunch. and then there's a cost of tuition fees, then there's a cost of caution fees if your child damages anything in the school, and then there's a cost of sports, and then there's a cost of drama clubs, and then there's generally the cost of healthcare. So there's additional costs that you don't count for. In this particular case, the only cost you're supposed to pay is tuition cost. So cost is a big one. Parents are saving a lot. Maybe finally I could talk about the quality of education and the quality of teachers. Most teachers end up teaching, again, waking up on the 12 to 15-hour schedule because of logistics. But in Kidato, they work the hours they're supposed to work, 6 hours at most. And so they have a lot of time to upskill themselves, go back to school, study more, improve their abilities to deliver better education. Rested teachers are better teachers, and they are more passionate doing their job. Teachers are the cornerstone of education. They are the presidents and the scientists and the engineers and the doctors. We all pass through the hands of the teachers. At Kidato, we really are determined to ensure that our teachers are having the best experience possible in their own lives, so that that can translate into the lives of the kids that we're working with. As a parent, I am concerned about my child having physical interactions with other children. And for this reason, starting 2022, we've implemented what we call Fun Friday, where Half-Day Friday, your child is picked by one of our transport managers, dropped in a specific location where they interact with these other kids and have clubs, they have sports, they have robotic sessions, chess sessions, debate sessions, and that will be happening bi-weekly. The fact is the world is changing, and we will more likely embrace technology than fight it. I think hybrid models are the future. I think e-learning plus in-person learning will be the future, and we have to find a way of making that happen, because we do still want to make sure that this in-person is not lost, that people are able to hang out and be with other people.
Such an inspiring story from Sam Gishuru in Kenya. Please do keep up the great work. We're going to go straight into our discussion with our panelists, and I want to start with Benjamin. Maybe you could just start off by telling us who you are, where you're from, and what is it that you do?
Thank you very much for having me here, and it's a privilege to really participate in Africa Health Check session, where we are going to look into how we are dealing with the pandemic, and also how it affected the education sector. To me, I'm Benjamin Karenzi. I'm from Kigali, Rwanda. I am the CEO of Zora Robotics Africa. We are a company that provides different robotics solutions, mainly in healthcare and with a major focus in education.
Really interesting that you decided to jump into robotics. Maybe you could just share some of the initiatives that you have undertaken in Rwanda under Zora Robotics.
Yes, great. In Rwanda, if I would give a little bit of a background, especially starting with 2019, most of the initiatives that we're working on were mainly to focus on how STEM subjects are delivered in the classroom. And this is to start with primary and lower secondary education. By using robotics, physical robots to enhance how these subjects are delivered. We speak of mathematics, we speak of physics, we speak of computers, and we also speak other sciences. But literally, when you go into the traditional methods of education, they are all theoretical. The other thing that we also did, not only in Rwanda, but also in Kenya and Equatorial Guinea, was the deployment of robots to help frontline workers amidst COVID. This is mainly with the places of public places, public buildings like airports and hospitals. I'm pretty sure you have seen the robots at the airports in Kigali and the COVID treatment centers, equally to Jakarta Kikwete International Airport in Nairobi and the Nairobi Hospital. So those are some of the initiatives we've been working on in the healthy care and also in education.
Absolutely. What would you say are the major impact of the virtual platforms, e-learning platforms that you have created as opposed to conventional learning in increasing access to education?
It is because as you see now with this COVID, the lessons we are learning from it is that we have to be flexible in terms of what we are doing and how we are used to do things. So looking at how schools are always on and off, but kids have to learn so that we also prepare the next generation. This is basically to avoid a gap in the future where our countries and our continent will miss certain skilled workforce because of this COVID. So we decided to put everything online so that we close that gap which is caused by stopped social gatherings and interactions.
Absolutely. Maybe just to jump to Dr. Mary, and you work in an education institution, and what has been the impact of COVID-19 in how you function at University of Nairobi, and how you ensure that your students are still able to access education, even though there were restrictions that were limiting the ability to come to the university?
Yes, so COVID, as we are calling it sometimes, a big disruptor. In fact, it came and disrupted the way we live, and particularly for this, the way we learn. We were used to having a teacher, and I was used to having students in front of me because I could see their reactions, I could see their understanding. There was that relationship that forged by having face-to-face meetings and lectures. But then COVID came, disrupted the way we work and the way we learn. But at the University of Nairobi, I really like how we moved on and forged the way forward. And this is where technology came in, and the use of very new innovations. And one of them is having these online platforms where the university quickly came together, created an ICT platform where students and lecturers could then meet at this platform hosted by the University of Nairobi. Of course, there's a huge contribution through public-private partnership, where the biggest telecom companies within Kenya, within Africa, came together and said they'll support the students. So each student got data bundles, free data bundles. Each lecturer, I myself, also got data bundles. So I could log on from anywhere in the world. And with that, we were able then now to create meeting rooms with our students and continue learning. So this process took actually the month of March and April of 2020. So innovation, technology, public-private participation, and also the willingness of students. We want to learn, they want to learn. Yes, there's this disruption, but we were able to quickly adapt and conform, and also be safe, because that was the main purpose of these platforms. But the side effects of this was lacking that physical interactions with our students, lacking that personal touch. Created a lot of vacuums, and this is where now we are starting to deal with mental health. Students need to interact also with each other. Now this student is alone at home or alone in whatever setting. The lecturer again is alone. So that partnership, that teamwork was again disrupted. And then with that we created other platforms where now students can log in, talk with university counselors, talk with other people who would ask them really deep questions. Are you okay? If you're not okay, how can we help? And with that again, we are able to deal with all these small fires that are coming up. Yes, big disruptor, but that has not stopped us from learning. And each student, be it from the farthest end where they probably don't have a laptop, each student has a phone, and the university has facilitated that they can get a grant to get a laptop and also this data bundle. So we are learning how to learn in this new era and this new this disruption, and we are progressing.
Yeah. Thank you for that, Dr. Mary. And maybe just to go to Reverend Achampo, you know, one of the beautiful things about technology is how it increases access, efficiency, effectiveness. But the downside is that it also increases inequalities. You know, for some kids, young people in Africa, having a cell phone, having access to a laptop is a luxury that they simply cannot afford. So how do we ensure that we mitigate those inequalities that are brought about e-learning and virtual platforms?
Brilliant, thank you. Yes, what I was saying is that the importance of this discussion today on the impact of COVID on the education sector is on these two premises, Gigi. Number one, that good education for all is the way forward for Africa into the future. And number two, that the children of today will be the doctors, the scientists, the lawyers, the engineers, and so on and so forth of tomorrow. Now, COVID has brought a lot of woes upon Africa. And my position this morning is that the same energy, the same convictions that we have to pursue medicine and healthcare to stop COVID, and the same momentum that we are applying to find stimulus packages and incentives to bolster our tottering economies, that same energy must be applied to sustain our education, because after all, the children who are suffering under the impact of COVID will be the tomorrow's leaders and champions of our society. That saying, Dr. Marianne has cited about the innovation at the University of Kenya, where the students are able to maneuver with their laptops and so on and so forth. Over here, not just over here, but in many parts of Africa, there are a greater number of people from early childhood learning through primary school who by themselves cannot do as the university students are doing. And then secondly, for children that come from unfortunate homes, poor homes, marginalized homes, rural areas, who have no access to electricity and power and technology and telecommunication connectivity to internet, we are talking about a whole mass of people where if government leaders and private sector institutions and individuals, we don't zero in to provide these technologies to our people, then the inequalities that you're talking about will come to place. So it is a healthy discussion, and I believe we'll be able to give some examples of what can be done.
Absolutely, Reverend. You know, there's on the one hand, people like Benjamin who provide these technology solutions, but on the other hand, the infrastructure is also very important. I usually joke with my colleagues abroad and say that you know that somebody is joining a Zoom or a WebEx call from Africa because our network is always poor, or we're going to have a power cut and you're going to drop off the call. Really unfortunate. But we're going to be talking about that just after this break. Let us go and have a hear or listen to what people on the street are saying.
Niko na watoto wa primary, niko na watoto wa high school, na niko na watoto wa college na university. Hapo nilipitia changamoto sana, sababu wale walikuwa kwa high school ilikuwa inafaa wasome online, na kulingana na mapato kwa hiyo nyakati pesa haikukua. Saa zingine mtoto alikuwa naweza kosa kuingia class.
Botswana, the curriculum was behind. We had to learn new things, we had to adapt, and that was costing us a lot of money because just to start with, internet is very expensive, and not every household could afford internet. So we had to adjust our budgets from the normal lifestyles we had to accommodate the learning times. And it happened that the observation is most especially from the government schools, some of the teachers were not even learned to do certain things. So we had to leave our busy schedules to assist the teachers there and there.
Merci beaucoup par rapport à cette question. Je vous dirais que cette technologie-là en ligne, vraiment, elle est récente. Elle est récente pour dire que les élèves des écoles primaires, même secondaires, leur faire étudier en ligne, vraiment, c'est un grand problème.
And that is it from the word on the street on this. You know, I was just saying just before the break that somebody's joining a virtual call or virtual learning platform from Africa when midway you get stuck or it freezes because of poor network, poor connectivity, or you have a power cut, then that one is joining it from Africa. So, let's talk about some of those challenges that you face, Benjamin, as a software engineer, somebody in robotics. What are some of the things that need to be done to mitigate the inequalities that come up with use of technology and inequitable access of e-learning and virtual platforms?
Great, thanks. This is an interesting question that you're posing, because before we even speak about the infrastructures, because there will be no way that we are going to have full coverage of internet and everything at hand. I would like to speak about something more important, which is with this COVID, there is a new language that has come out, the new normal, and especially the new normal with COVID. And this is actually an issue of concern for people who are past 25 years of age. Because those who are 25 below, going to 4 years, 5 years, 16 years, 20 years, everything is new to them. So there is no old ways, and everything is new to them. And during the entire pandemic, we have been facing one challenge, which is probably other panelists who are also focused into the education, they will say something about it. The challenge is when we are trying to launch these systems that could mitigate, help in reducing the effects of COVID to the education system. The resistance comes much from the educators, not the learners. Last week, I was in we had a program that we were running in the eastern province of Rwanda. It's called Scratch. This is for primary and Scratch, the primary and secondary schools. And some of the testimonies we are getting from the students and the teachers is that now teachers are trying to look at themselves as facilitators, not about teaching. Because in this era of the 21st century, there is a lot of materials out there that students access with or without the permission of a teacher.
Yeah.
And some students have decided to do personal learning, home learning, in a way that by the time an educator is giving a certain set of materials, perhaps, and most of the time, students already have information about, or they have read about that chapter in there. And you find for some teachers who are not, educators who are not ready to embrace this era, there is a conflict between students and some teachers look at students as if they are trying to outsmart them. But really, in the testimony, one key message was that educators today need to be facilitators of students.
So they feel a bit intimidated. They feel a bit intimidated by the technology. Maybe, quite frankly, Benjamin, does your kind of technology pose a threat to the jobs of teachers?
Not a threat to the jobs of teachers, because either way, these students need to be guided. But with this technology, because we are trying to promote critical thinking, innovation, and if you're looking at critical thinking and innovation, the limitation is the imagination at an individual level and what inspires any of either the learners or the educators. So if today I bring students into our showroom, or if I visit a school, students will challenge even the robots I have here. They will say, why do you have an autonomous robot, not a flying robot? They will challenge every concept you bring to them. And that way, to us, we see as mission achieved, because what we need, we are trying to facilitate, to show the students, and then they can be innovative, they can come up with creative thinking. And we look at ourselves like, yeah, this was the limitation of our imagination, and these kids are coming up with totally smart ideas. And so that's where I would say, on the infrastructure part of it, true, there is a gap, because some students were able to continue learning because of how, because they already had these facilities. They had internet in their homes, they had computers at their disposals, but there are many students who did not continue learning, and that is the huge gap. And I think this is a topic that our governments and the international organizations that really need to look into to facilitate in terms of deploying these infrastructures that will enable equitable learning process.
Absolutely. And Dr. Marianne?
Yes, mental health is a big topic right now. As you know, I'm a head of a department at the University of Nairobi, so I deal with students who are actually been adversely affected, both socially, economically, and also physically because of this COVID-19. So we are dealing with a real-time problem, and we need to come together and get these solutions. Some of the solutions we are giving our students particularly is to make sure that they can access care, mental health care, and this solution was actually created by the students of the University of Nairobi and other universities within Kenya. They've created an app, and these students have made sure that by the time you're registering as a University of Nairobi student, you can access that app. That app has online counselors, online information about drug use, online information about psychology, counseling, and all other issues that students may face, even sexual health. And with this, they're able to interact. They may not be able to see the person they're interacting with, which again is an advantage because of also privacy issues. And they're able to articulate their problems, and with these problems, they get some solutions. As the Reverend has said, we are Africans. We as social human beings, we need to see one another. So we have a vaccination drive within the university, within many centers in Kenya, and also within Nairobi where we are. And we are urging our students who are all over 18, all our lecturers have been vaccinated, so that we can create an avenue where we can come back to normal. Another issue here is to have enough space, infrastructure, where we can meet safely, where we can have some social distances. Our classrooms, are they well ventilated? So we are looking at all this problem at a 360-degree angle, making sure that we are dealing with the problem of mental health, we are dealing with the problem of the pandemic, making sure we are adhering to the measures, and also creating platforms and avenues where we can physically meet safely, and so that we can socialize and move on with our lives with this new normal. And I believe we are going to get there. Thank you.
Absolutely. Thank you so much for that. And I think that's a really powerful way to end off that. Let us embrace technology. It is not the enemy, but it's just to enhance the way we've been doing things and to increase access to education platforms, because education is indeed the key to attaining one's dreams and indeed unlocking other more possibilities. Thank you so much, Benjamin, Reverend Anthony, as well as Dr. Mary Ann, for such really enriching and insightful conversation. We have come to the end of this week's episode. Remember to keep in touch with Africa Health Check on all our social media platforms. We would like to hear feedback from you. What would you like to see us discussing on this very platform? Make sure to catch us every week, same time, same place. Until then, remember that the future is Africa, the future is today.